Medicare is a valuable government-provided health insurance, but did you know that there are some important aspects of healthcare it doesn't cover? In this video, I'm going to share with you 5 things that Medicare does not provide coverage for. But first, I want you to hit that subscribe button so you never miss an episode on the Senior Resource Network. My name is Jennifer, and I'm here to answer your questions and connect you with the most helpful resources you're looking for, whether you're well into your golden years or just planning ahead. Being informed about what your policy covers and doesn't cover is going to help you determine how best to protect yourself. Today we're talking about Medicare and the 5 most common things it doesn't cover. Medicare is notorious for not covering long-term care. Long-term care is basically when you stay in a place like a nursing home or an assisted living facility. If the possibility of needing long-term care in the future concerns you, then you're going to have to explore other options like long-term care insurance or personal savings. Of course, it's worth noting that in limited circumstances, Medicare will pay for nursing home costs in full if a doctor recommends a short-term stay for medically necessary treatments. Medicare does not pay for dental care like cleanings, fillings, dentures. It's also not going to cover vision exams, eyeglasses, or hearing aids. You can buy special dental or vision plans to get these services, or you can look into Medicare Advantage plans that have more benefits. Original Medicare, it's not going to pay for prescription drugs. If you need prescription drugs, you're going to want to sign up for a Part D Medicare plan. Some Medicare Advantage plans may also include drug coverage. Just make sure that you do your research first and find the best plan that works for you and your needs. If you're planning to travel abroad, you should know that in most cases, Medicare does not cover health services received outside of the United States. However, it may cover emergency care in other countries. If you're traveling extensively, consider purchasing travel medical insurance. Medicare generally does not cover cosmetic procedures, as those are considered more elective and not medically necessary. However, it will cover some cosmetic procedures on a limited basis if the treatment is needed because of an injury or if it's doctor prescribed to improve the function of a malformed body part. So wrapping up, we want you to remember that Medicare, it's a dynamic system and changes can and do occur. So keep yourself updated with the latest information. Don't be afraid to ask questions and explore your options. In fact, we have a friend of seniorresource.com that we want to mention. Her name is Tony King. She is the Medicare expert. She can answer any and all of the questions you'll ever have about Medicare. You can visit her over at tonysays.com, subscribe to her podcast, Medicare Moments, or check out her YouTube channel. Trust me, if you're nearing the age of 65, if you're confused about Medicare, or maybe you're just looking into some info for a family member, she is the person you want all your advice from. Anyway, thanks for watching today's video. If you found it helpful or interesting, don't forget to like it, share it with your friends, and subscribe for more great content on the Senior Resource Network.